How do I make a complaint?
There's lots of times, I think, when patients aren't happy with what doctors and what treatment services provide. And I think the first point of call, if you've got a complaint, is as soon as that happens, is to let the doctor or the clinician or the pharmacist know that something about the interaction you've just had with them has left you feeling unhappy. And that whole process of simply letting someone know that something they've done or said, whether intentionally or not, has caused you some distress can be one way of actually avoiding having to make a formal complaints process.
There are many ways of complaining, and it will require a bit of investigation in different circumstances, and it's something that many of us who work in this area really encourage drug users to do, to make complaints, because the more complaints that we receive that are reasonable and that we can act on, the better the treatment becomes, and then you and others after you will receive better treatment. If you think you've been badly treated because you made a complaint, you can go back to the people who you got advice from to ask about what next. Sometimes when you live in a remote or rural area where there's only one prescriber, only one pharmacy, frankly, my advice to you would be to really have a good think about whether you really want to risk everything. So sometimes it's better not to make a complaint.